Join me as I dive deep into the surprising connection between diabetes and high blood pressure and see if I can break it down in a way that's easy to understand. Diabetes and high blood pressure are two of the most prevalent health conditions affecting millions of people worldwide. While they're often discussed separately, there's a critical connection between the two that's essential to understand, especially if you're living with one or both of these conditions. The link between diabetes and high blood pressure is significant, as these conditions often coexist and exacerbate one another, leading to a heightened risk of cardiovascular and kidney complications. Here's an overview of how they are interconnected. Insulin resistance. In type 2 diabetes, the body's cells become resistant to insulin, causing the pancreas to produce more insulin to manage blood sugar levels. This overproduction can contribute to high blood pressure by affecting how the body processes sodium. When insulin resistance is present, the kidneys may retain more sodium and fluid, which increases blood volume and subsequently blood pressure. Impact on blood vessels. Diabetes, particularly when blood sugar is poorly controlled, leads to damage to the blood vessels and arteries over time. Elevated blood sugar causes inflammation and stiffness in the blood vessels, reducing their ability to dilate properly, leading to increased resistance and higher blood pressure. Over time, this damage can lead to atherosclerosis, or hardening of the arteries, which further increases the risk of hypertension. Shared risk factors. Diabetes and high blood pressure share many common risk factors, including obesity. Excess weight strains the heart and can lead to insulin resistance and increased blood pressure. A sedentary lifestyle is another factor. Lack of physical activity contributes to both insulin resistance and high blood pressure. An unhealthy diet also plays a significant role. Diets high in sugar, salt, and unhealthy fats are linked to both conditions. Chronic stress is yet another risk factor. Stress hormones can raise blood sugar and blood pressure levels. And, of course, smoking and alcohol. Both contribute to the development of these conditions. Kidney damage. Both high blood sugar and high blood pressure are harmful to the kidneys. Diabetes can damage the small blood vessels in the kidneys, known as diabetic nephropathy, reducing their ability to filter waste from the blood. High blood pressure also damages the kidneys by increasing the pressure inside these delicate vessels. When the kidneys are impaired, they can't regulate blood pressure effectively, creating a vicious cycle that worsens both conditions. Increased cardiovascular risk. People with both diabetes and high blood pressure are at significantly higher risk for cardiovascular diseases such as heart attacks and strokes. The combined effect of elevated blood sugar and blood pressure accelerates the development of atherosclerosis, where plaque builds up in the arteries, leading to reduced blood flow to the heart and brain. Managing the connection. Given the close relationship between diabetes and high blood pressure, managing one condition often helps with the other. This includes blood sugar control. Maintaining healthy glucose levels reduces the strain on blood vessels and organs. Blood pressure management. Keeping blood pressure within a healthy range protects the heart, kidneys, and blood vessels. Lifestyle changes. Regular exercise, a balanced diet, and weight management can help prevent and manage both conditions. Medications. Doctors often prescribe blood pressure-lowering medications to people with diabetes to reduce their risk of complications. By addressing both conditions together, individuals can significantly reduce their risk of heart disease, kidney failure, and other serious health problems. Don't forget to leave your thoughts in the comments below. We would love to hear from you. Please subscribe to our channel if you'd like to learn more about healthy lifestyle tips.